Our next module will continue with a discussion of novel coronaviruses and specifically SARS and MERS, which we will discuss in some detail. Again, I would like to acknowledge Dr. Alex Isaacoff from the Section of Pre-Hospital and Disaster Medicine, Department of Emergency Medicine at Emory in Atlanta for the use of his slides in developing this presentation. SARS, or the Severe Acute Respiratory Syndrome, is a viral respiratory illness caused by a coronavirus. It was first reported in Asia beginning in February of 2003 and very rapidly made headlines around the world. Overall, after the outbreak has ceased, there were a little over 8,000 individuals known to have been ill in 29 countries and nearly 800 individuals who died as a result. There were only 8 people affected in the U.S., however, very fortunately for our country. And the last reported case occurred in April of 2004 in China. It was due to a laboratory exposure, and we've not seen cases of SARS, fortunately, since that time. The clinical symptoms of SARS are rather nonspecific. They include fever of 100.5 or greater, headache, malaise, myalgias. 10 to 20% may have diarrhea. After 2 to 7 days, a dry cough will ensue. That typically, in more severe cases, progresses to a pneumonia. And the pneumonia can be severe because roughly 6 to 10% of those who are infected who progress to this state will die as a result of infection. SARS transmission occurs mostly by close contact involving respiratory secretions, contact usually with droplets that are expelled during coughing or sneezing. There's also evidence for transmission via aerosols over the airborne route, that is, microparticles that are able to cover very long distances that may infect individuals who are beyond the 3 to 6 foot zone in which larger droplets are normally transmitted. It's also importantly been transmitted in healthcare settings, but generally before important level of infection control measures have been affected. The major outbreaks that we'll be talking about today, first in Hong Kong, of 138 secondary and tertiary cases, 62% involved healthcare workers. In Toronto, which was the major outbreak in the North American continent, of 73 secondary and tertiary cases, 51% were healthcare workers. So clearly, the attack rate among individuals caring for patients with SARS is an important issue, and institution of infection control procedures that were appropriate were critical in allowing the transmission finally to cease and to gain control of the situation. If you look at the occurrence of SARS in Toronto, Canada, notice that the index case occurred on February 23rd and died on March 5th. That individual directly was in contact with a son who died of the same disease, became ill on the 27th of February, died on March 13th. Having arrived from a destination in the Asian continent. The the index case and the secondary case gave rise to a number of tertiary cases that rapidly spawned exposure to various healthcare workers and sustained the outbreak through failure of appropriate infection control procedures, through cycles that unfortunately caused some degree of havoc in the healthcare system in Canada at that time. The outbreak itself has been detailed in numerous scientific publications, but the take-home message about what was going on there that led to the outbreak being sustained and being so severe were that there was significant overcrowding, and for example, in waiting areas where individuals who were infected were located, that there were open observation areas for individuals with respiratory complaints, for people to circulate among those persons without respiratory disease. There was use of aerosol treatments or nebulizer treatments that resulted in the generation of aerosols that may have been, unfortunately, highly effective in transmitting the disease to others. There was poor compliance with hand washing initially, and there was unrestricted access by visitors to the hospital, which severely impacted the ongoing transmission of disease. In the next section, we'll look at additional detail about the Toronto epidemic.